Now, against the backdrop of the outbreak of vaccine-derived polio incidents in Nigeria, particularly in the northern parts of the country, the Nigeria National Polio Plus Committee of Rotary International is set to begin an intensive routine vaccination tagged outbreak response from Friday, the 4th of February 2022. We're now being joined by the chairman, Nigeria National Polio Plus Committee of Rotary International, Dr. Tunji Funsho, to talk about the outbreak of vaccine-derived polio incidents in Nigeria, particularly in the north. Welcome to the program.
Thank you for having me.
Okay, so let's start at the very beginning. Is there an outbreak in the country at the moment, or there isn't an outbreak? Where are we exactly?
Well, at the moment, we cannot say we have an outbreak, but technically, yes, that is the way it is defined. An outbreak is a situation where you have a particular disease occurring more frequently than it normally does in that particular environment. And so the vaccine mutant variant of the polio virus is what we are contending with now. Having seen over the course of last year almost 600 cases across the world. As a matter of fact, just not in Nigeria. Nigeria just happens to have had a much larger dose incidence of the disease and also a much more protracted outbreak. In other words, we've not been able to put a lead on that outbreak.
And it's just a little bit confusing because a couple months or sometime last year, we knew that Nigeria had eradicated polio along with some other countries around the world. And now we're hearing that there is it's a mutation of the polio virus. And it happened last year over, I'm just saying timing-wise with COVID-19. It seems like a spike was reintroduced into the country around the time that the pandemic hit. Correct me if I'm wrong. Could it be that there's a bit of a distraction from polio because of COVID and the large numbers that COVID has pulled in around the world?
That's right. You beat me to that explanation. Yes, that has been one of our challenges. We had to pause polio immunization, both the routine immunization that parents take their kids for in healthcare centers, and also these kind of interventions we've done on a regular basis, more because of the wild polio virus, to ensure that children who have been missed because they have no access to primary healthcare to get their vaccinations, that we regularly go house to house to fill that gap. But for about 6 to 8 months in 2020, we were not able to do any of those. And families were also unable to go to primary healthcare centers. Either they are short, because of COVID, or they are scared of getting out and getting infected. So that has contributed a lot in having a cohort of children who should be vaccinated who are not vaccinated. And that is where virus mutation comes in. The longer the transmission, the higher the chances of mutation. We've seen that, as you are witness to with COVID-19.
Yes.
And that is what viruses do. The more they have the opportunity to transmit, the higher the likelihood that you'll get a mutation. This is what has happened with the vaccine virus.
So children who have taken the oral polio vaccine, are they immune from the vaccine mutant polio virus, or do they have to be vaccinated again?
They are immune if they are optimally immunized. When I say optimally immunized, the polio vaccine schedule for children is 4 times. So if you've had your first dose and second dose and third dose, the likelihood that the variant will touch you is very, very slim indeed. But what we also know is that the mutant variant festers in an environment where children are suboptimally immunized and where there is easy transmission. In other words, they live in unsanitary environments where contaminated stool with the mutant variant, virus gets into the sewage, then gets into the drinking water, either from streams or from, untreated, water situations, gets into these children who are suboptimally immunized. In a lot of cases, also undernourished. Then the virus can take root, and cause infection.
Okay, so what can be done then to sort of address the situation? And I think we should probably address this from every corner in terms of the people, the state, and the federal government. Is there anything that can be done to sort of limit the numbers?
Yes. I think, let's start from the government. I always, say that you cannot shave a man's head in his absence. All we are doing, as partners in this program, be it Rotary or UNICEF or WHO or the Gates Foundation, is to support government's efforts. So government normally leads the charge. But, what we have discovered is that, like even families themselves, as soon as, August 24th of 2020 announcement came, while polio virus, free Nigeria, we took our eyes off the ball at that level of, governance and moved to other priorities. So polio eradication went to the back burner, and new priorities, took place, such that, when we are asking for government intervention in some states, which requires funding, and very importantly, public mobilization. People need to know you have an intervention, you're going to come to their homes to give their children vaccines. With all the conspiracy theories around, you just don't open your door to any stranger who says, I've come to give your child a vaccine. But if there have been adequate awareness created through the media, for instance, and also through other channels of communication, traditional leadership, political leadership, influencers that the people believe in, or, agents, of government who are paid for that purpose, or who the people trust in. And this is where Rotary comes in, because we are literally everywhere. There's virtually no local government in Nigeria you wouldn't find a Rotarians, and, people know we are not government. And so we're not coming here to support vaccination because somebody is paying us or somebody is doing something untoward. So there's a need for all of us, the government and all the partners, to put our hands together and synergize to ensure that people know this thing is going to happen. They appreciate it is good for them. And if there are any concerns about the safety of the vaccines, we explain it to them in advance. Because part of our experience barely 2 weeks ago in Abuja is that some estates will not open their doors to us. Or let me say to the vaccinators, until we arrive on the scene and they see, oh yes, these people look responsible people. They seem to know what they're talking about. Okay, thank you.
And that's actually what I was going to ask you about, vaccine hesitancy, because we've seen all over the world, especially in the highly educated countries, they don't want to take the vaccine for COVID-19. There are all these side effects that could be manifested from them. How much harder is it to sensitize a nation where the education level, or a section of the nation where the education level isn't even very high? There's high population density and a lot of mistrust towards the government. As we know that some of these vaccines over the years, not polio, but for other reasons, had caused major damage afterwards to large groups of people who had taken their vaccines. I think it was back in the 70s and 80s. So I'm just wondering, how is that possible to sensitize them enough to let them know that when they take the vaccine, they will be safe? And are there side effects of the polio vaccine for children?
I think I will start from that. There are no side effects. And also there are no excessive dosage. A child can be given the polio vaccine up to 10 times. Particularly in environments where children are malnourished, the immune response is not usually, very high. Not very alert. So at a particular time, you can give the vaccine and the vaccine doesn't evoke the response you want. And when they're better nourished, it evokes the response. So there are no side effects for the vaccine. As to non-compliance and hesitancy in taking the vaccine, we faced that maybe about a decade and a half ago, that even some states decided they're not going to, immunize their children at all at the governmental level. But we've been able to solicit and gain the support of our traditional rulers, particularly in the north, who the people trust, and show them evidence, of where these vaccines are produced, The ones we were using at that point in time in Nigeria were actually produced in a predominantly Muslim country of Malaysia, and some of them were taken there to see these, manufacturing concerns and see the evidence that it is safe. And they now are able to convince their population, to accept the vaccine. So vaccine non-compliance is much, much less, is not much of an issue now. It's actually getting the vaccines to the children. As you know, we've had issues of terrain. Even in Lagos State, there are areas that you cannot reach in certain seasons, because, water just takes over the whole place. And in the north, desert environments that you need motorbikes to get to certain areas.
Well, apart from terrain, what about the issue of security as well? How do you navigate that to reach as many children as possible?
Well, this program has been very dynamic and has also been, in a lot of times, very innovative in countering some of these challenges. When we had issues of access in the Northeast, for instance, we got to a point where the military medical service actually were doing the immunization in areas that vaccination could not reach. Prior to that time, we were having military escorts for vaccination teams. But when we got to a point where it was not even safe, to take vaccination team under military escort, the Armed Forces Medical Service took over the responsibility of immunizing children in those areas.
And just very briefly, just to sort of paint us let us know the gravity of the situation at the moment, perhaps you can help us paint a picture in terms of statistics, because earlier on you mentioned about 600 globally, perhaps if you narrow it down to Africa and even Nigeria particularly, perhaps that will help us get a better understanding of really what's going on, especially as well if you take into consideration the different let's even just talk about the zones where it's predominant really.
Well, the numbers in Nigeria are about 400. And out of these 400 really, because we also count not just paralysis in children, we also, count the number of times we have found the virus in the environment. So one of the ways we keep ahead of the virus is not only to check children who are paralyzed, but also to check, the sewer systems or wherever else stool is able to have access to and see if the virus still resides there, because that's where the children are going to, get, infected. So overall, we have less than 300 children who have been paralyzed as of 26th of January in Nigeria. And it is spread across most of the northern states. But we've had, incidents in Lagos State, we've had incidents in Bayelsa, right, for instance. So it is not restricted to the north, but it's predominantly in certain states in the north.
All right, well, then. Dr. Funsho, thank you so much for coming in for this interview this afternoon, and all the best with the outbreak response event that you all will be doing tomorrow.
Thank you very much.